What is Millennium Goals? The Millennium Goals are a set of targets established by the United Nations to address various global issues, including poverty, education, gender equality, and healthcare. They were designed to be achieved by 2015, with HIV/AIDS being one of the critical health-related goals. Acquired immunodeficiency syndrome, AIDS, is the most advanced stage of HIV infection. HIV weakens the immune system by targeting white blood cells, making individuals susceptible to opportunistic infections and certain cancers. AIDS is primarily transmitted through bodily fluids such as blood, semen, vaginal fluids, and breast milk. However, it cannot be transmitted through casual contact like hugs or sharing food. National STD/AIDS Control Program, Sri Lanka, the program, led by the Ministry of Health, offers various services including sexual health services, laboratory testing, HIV treatment and care, antenatal care, prevention of STIs and HIV, advocacy, training, HIV self-testing, and PrEP and PEPs, pre-exposure prophylaxis and post-exposure prophylaxis. These services aim to prevent and manage HIV/AIDS in Sri Lanka. According to WHO, World Health Organization, currently, in Sri Lanka, the estimated number of people living with HIV is 4,100 and AIDS-related cumulative deaths is less than 100. The HIV epidemic is currently concentrated among key population groups with an overall positivity rate of 0.5%. Here in this, we can see that how many overall AIDS patients live among the population from 2000 to 2020. However, these numbers can increase. Because these are only the identified cases by doing lab tests, there may be many patients that have not been yet identified. This is an insightful analysis by WHO showing new AIDS patient discoveries spanning from 2011 to 2022. This graph offers a clear depiction of the evolving trends over the years. Despite concerted efforts and precautions, we observe an overall increase in new cases, indicating persistent challenges in combating this disease. However, what's particularly striking is the significant rise in male patients, contrasting with the relatively stable rate among female patients. This disparity warrants careful consideration and highlights the need for targeted interventions and tailored approaches to address the specific vulnerabilities faced by different demographic groups. As we navigate through this data, it becomes evident that our battle against AIDS requires a multifaceted strategy that accounts for the nuanced dynamics at play. This is the latest findings on new AIDS patients discovered in 2022. There have been identified total of 724 new cases in 2022. Our comprehensive analysis divides the data by province and district, providing valuable insights into the situation. Remarkably, Colombo and Kandy emerge as key areas, accounting for a total of 130 newly discovered patients. Additionally, the Western Province shows the highest concentration of patients at the provincial level. To visualize these insights, we've crafted a frequency polygon depicting how patients were distributed across districts. Furthermore, a pie chart illustrates the percentage of patients in each province, offering a clear understanding of the regional impact. These graphical representations not only enhance our comprehension but also serve as powerful tools in addressing the challenges posed by AIDS. National STD/AIDS Control Program gives aid in preventing HIV. This involves using condoms during sex, getting tested for HIV and other sexually transmitted infections, voluntary medical male circumcision, harm reduction services for drug users, and taking antiretroviral drugs for prevention. Antiretroviral drugs can also be used to prevent mother-to-child transmission. You can go to their site and apply for tests, treatments, and many more services regarding this matter. This is the link to the site, and it is down below on the video. As we conclude our research journey into the realm of AIDS, it's crucial to recognize the gravity of this global health challenge. Through our exploration, we've shed light on the complexities surrounding the transmission, prevention, and treatment of HIV/AIDS. However, our work doesn't end here. It's imperative that we continue to advocate for comprehensive education, accessible healthcare, and inclusive support systems for those affected by this disease. By fostering collaboration, raising awareness, and challenging stigmas, we can move closer towards a world free from the burden of AIDS. Thank you for joining us on this important endeavor. Together, Let's strive to make a meaningful difference in the fight against HIV/AIDS.